Good morning. What is the first image that comes to our minds when we think of climate change? Perhaps this. At least it was for me for quite a few years. A polar bear standing alone on a piece of melting ice. It's sad, it's tragic, but it's a powerful image. But at the same time, it seems distant, something far away, far from our homes, from our families, and from our everyday lives. But the health effects of climate change are not always distant. They can appear as unpredictable rainfall, extreme heat, inaccessible healthcare, and a constant worry or anxiety of what is going to happen next. My first encounter with that fear or anxiety came when I was working in Himachal Pradesh, a place I call my home, the mountains. One incident there completely changed the way I look into climate, health, and access to care. This is an image of me with one of my close friends and a work colleague in one of the many snowfall seasons that we enjoyed together. One such season, she was expecting a baby. We were joyous. One morning, she developed extreme pain in her abdomen. We were in office, and the weather was very, very bad that day. There was heavy rainfall, landslides, heavy snowfall. You know, the kind of weather when even the vehicles, they don't move on the road because of the risk of getting skid on freshly fallen snow. We tried, but we could not take her to the hospital. Later that evening, her husband arrived. He carried her in his arms and took her to a nearby hospital. Sadly, she passed away the next morning. Now I want to be very careful here. We cannot say that climate change caused that particular weather event or whether delay in care was the only reason that she could not survive. But that day taught me something very important. I'm a public health professional and most of my work revolves around healthcare financing, meaning that people have access to medical care without getting any financial distress. But that day taught me that cost of care is not the only barrier to healthcare. The doctor was there, the hospital was there, public health policies were in place, and still she could not survive. I became very uneasy, and that feeling of uneasiness grew in me. Every monsoon, I became more and more anxious. I witnessed heavy rainfall, landslides, trees falling, people losing their homes, people losing their loved ones. And a fear gripped me. What if one day even my home gets swept away in one of these landslides? At that time, I did not have a name to that fear, but today I have. Climate anxiety. Climate anxiety is the fear or worry of what climate change might do to our families, to our homes, to our future, and ecological grief, meaning the sadness for what is already being lost. And these are not just experienced by few people. As per a Lancet study published in 2021, which surveys approximately 10,000 individuals, young individuals, across 10 different countries, including India, it was found that 59% of them were extremely worried about climate change. And 45% of them also reported that this feeling of worry was affecting their everyday lives. So climate change is not just something which is happening in the physical world around us. It is also something which is shaping the way we think, we feel, and we perceive our futures. And why not? The pattern is really changing. India, between 1901 to 2018, has witnessed an increase in the average temperature of 0.7 degrees Celsius. It may seem small, but it's an average across the entire nation, different seasons. The second figure, the heat wave duration. In the heat wave affected areas, the duration of heat wave days has increased by 2.5 days in last 30 years, meaning we are not only experiencing higher temperatures, but also extreme heat for longer durations. The third figure, average extreme daily rainfall Between 1950 to 2015, it has increased by 75%. In simple terms, the rains are becoming unpredictable. There might be huge amount of rains falling in a very short duration of time. And these changes are even more visible in the Hindu Kush Himalayan region, including my home in Himachal Pradesh, where the average temperature has risen by 1.5 degrees Celsius between 1951 to 2014. The glaciers are receding, and also we are witnessing less and less snowfall every year. So the fear is not just in our minds, it is something which is really happening around us. For a very long time, I thought that climate change and public health were two separate fields, and that climate change belongs to environmental scientists, until my experience in Himachal Pradesh, which taught me that these are not separate, and they need not be discussed in two separate rooms. Climate change is a public health issue. In the event of a landslide or a flood, the immediate damage is clearly visible, but what is not visible is the subtle health effects. A blocked road can prevent an ambulance from reaching a critically ill patient. We may not be able to supply the essential medicines, drugs, healthcare workers to the communities which get cut off during those climatic crises. So what seems to be an environmental event soon turns out to be a public health crisis. And the relationship goes much deeper. Like in case of heat waves, there are chances of heat stroke, dehydration. It also affects our heart and our kidneys. The temperature and rainfall, which is changing, it increases the prevalence of vector-borne disease like malaria and dengue. And as per the WHO estimates, between 2030 to 2050, approximately 250,000 deaths every year will be attributable to climate change. That's why I could not see these two as separate circles. That is where the intersection lies, and that is where we are. Once I understood this relationship between climate change and public health, the next question came. What helps the communities to cope up? And I found that the answer lies within the communities themselves. That's when I joined the folk organization, the Foundation of Living Knowledge, as a member and as a volunteer. Folk works with different communities in different Himalayan regions. It also believes that climate change, the communities are not only affected by climate change, but they also carry immense knowledge, immense experience, and also the possible solution. So one of the work which we did with folk was documenting the knowledge and practices of the community, the traditional knowledge and practices, including the knowledge about the traditional medicinal plants, also commonly called the jadi-bootis, and how the communities have been using them over generations. The second part involved documenting how the communities respond to these events of climatic crisis, like landslides, flash floods. What difficulties do they face, which areas get cut off, how the communities stand together, and what local resources are available with us. The third part involved training of the community people on climate change, on disaster risk management, first aid, giving a CPR, and also the risks of the possible climatic changes which are happening around them. My work with folk taught me that communities, when they stand together, they get the power and courage to face any situation. It also taught me that we need not be an environmental scientist or a public health expert to deal with this issue of climate change, but each one of us can do our bit for this cause. In my last slide, I'm just going to leave you with a few thoughts, with a few pointers which you and me as common people can do to tackle this issue of changing climate. The first one is to notice. Notice what is happening around us, what changes are happening around us. Notice how we are using electricity and water, how we are traveling, how much food do we consume, and how much gets wasted. The art of noticing is the first point where change begins. The second is to prepare. Prepare for any warning signs. In case there are any warnings, just track those where landslides are happening, if there is a possibility of a heat wave. And if there is such a situation which is arising in the coming times, be prepared with at least essential things like drinking water, some medicines, your important documents. And always ensure that we help children, vulnerable people, critically ill patients, women first. The third point is to connect. Connect to your community. connect to your neighbors, to the organizations that are working for this cause. Always ensure that the right information is spread during those times. Always remember that a connected community is a stronger community. And the last point is to participate, however you can, in whichever way you can, like using public transport wherever possible, cycling or walking wherever possible, rational use of electricity and water. These are very common points which all of us should take care of. Saving our trees, saving our natural resources, encouraging those organizations that are working for the cause of climate change and public health. I know that individuals alone cannot solve this problem of climate change, and governments, larger organizations, industries have a much larger role to play. None of us can do everything, but each one of us can do something. I started my presentation with the concept of home. Home is not just a place we locate on map. It's a place where we feel safe, we feel cared for, and we feel connected. My experience with climate change taught me how fragile that feeling is, how transitory that feeling is. But my work with community also showed me that hope is always much, much bigger than fear. It is not in our hands to prevent every climatic event, but it is in our hands how we prepare for it, how we care with other people, and how connected we are during those times of crisis. Together, we can make our home feel like home again. Thank you.